Our next story is about a silent pandemic in India. Food adulteration is silently poisoning the country, and the crisis is worse than most realize. From milk and spices to honey and paneer, chemicals, water and synthetic additives are all infiltrating our daily diet. It is a growing public health emergency that threatens children's growth, immunity and the long-term health of the nation. And this threat is not limited to one region or one market. Adulteration is being reported in wholesale bazaars, small retail shops, informal dairy networks and roadside food chains. High-value items like milk, cottage cheese or paneer, ghee and edible oils are repeatedly flagged in testing drives. Spices such as turmeric have been found laced with lead chromate, which is a toxic industrial pigment that can cause serious lead poisoning, especially in children. Milk is diluted with water and then masked with detergent, urea and synthetic chemicals to maintain appearance and shelf life. The list is long, and the recent scandals are even more shocking. Last year, at the Sri Venkateshwara Swami temple in Tirumala, which is one of the most sacred shrines in India, investigators found that spurious ghee worth over 250 crore rupees was supplied between 2019 and 24. The ghee was allegedly made using chemicals like monodiglycerides and acetic acid esters. Similarly, ahead of last year's festive season, the FSSAI flagged paneer as the most adulterated food item. In Uttar Pradesh's Noida alone, 550 kilograms of fake paneer was seized and destroyed. Official data shows 83% of paneer samples tested failed safety norms and 40% was found harmful, adulterated with palm oil, urea and synthetic chemicals. Honey, which is marketed as pure and natural, has been found diluted with sugar syrup. A Lancet study reports that India has the highest number of diabetes patients in the world, with an estimated 212 million cases. Even this minor adulteration can have massive long-term effects. And let's not forget the cough syrup scandal from Rajasthan that exposed how contaminated pharmaceutical products could turn. In fact, fatal for young children whose lives were lost. The health impact is devastating. India is already battling a nutrition crisis. According to the NFHS5 data, 32% of children are underweight, 35.5% are stunted, and over 19% suffer from acute malnutrition. More than 41 million children suffer from stunted growth. When food is stripped of nutrition and laced with toxins, it doesn't just cause food poisoning. It leads to chronic toxic exposure, weakened immunity, developmental damage, lifestyle diseases, and massive healthcare costs that burden families and the economy. So why does this continue? India has a strong legal framework on paper. The Food Safety and Standards Act of 2006 that provides for strict penalties, including life imprisonment and fines of up to 10 lakh rupees for unsafe food. The Indian Penal Code and the Bharatiya Nyaya Sanhita also provide for punishment. The Consumer Protection Act allows citizens to seek damages. The FSSAI sets science-based standards. Food safety officers are empowered to inspect and seize goods. State governments are responsible for enforcement, but implementation remains uneven. Small producers operate on thin margins. Adulteration boosts short-term profits. Laboratory infrastructure and trained human resources remain inadequate in several regions. However, there are efforts that are underway. The FSSAI has notified 246 NABL accredited laboratories and 24 referral labs. 305 mobile food testing vans are operating across 35 states and union territories. Surveillance, random sampling and targeted enforcement drives have all been intensified. While the regulator is expanding capacity, the crisis demands a system redesign with consumer awareness and more strict punishments, because what reaches our plates matters. Food adulteration is a silent assault on public health, and if it's left unchecked, it could become one of the biggest health security threats that India faces.